Hi, this is Dr. Noor calling from Progressive Pediatrics. I have here joining with us Colette. She's a certified pediatric sleep coach who's joining us to answer some questions that we have as providers and as well our patients have too. So without further ado, Miss Colette, please go on.
Oh, thank you so much, Dr. Noor. I'm so happy to be here and talk to your patients and you as amazing providers about what sleep means for infants as well as toddlers.
Mhm.
So a little bit about me. I am certified as a pediatric sleep coach and also certified as special needs sleep as well. I am the owner and founder of SleepBabe, and that is my pediatric sleep business, which I love so much. It is the light of my life. And what I do is I work with families on how to sleep train their babies, really up to 8 years old, in methods that align with your parenting approach and your parenting philosophy, and also really keeping at the core of what your baby's temperament and personality is. So it's really aligning all those factors to be able to put together a plan that really aligns with your values to help families get the rest they need and also for babies to thrive too.
All right, so I have our first question. So it's a very generic question, but it's a very important question that many of our parents, and also generically to start with the topic of sleep, that we all have. Why do we all need sleep?
Yes. Oh my goodness. That is such a great question, Dr. Nora. And when we think about sleep, what we are looking at is literally one of our body's primary functions to be able to restore our muscle growth, hormone regulation, protein synthesis. It is a core function for us to be able to grow and develop, not only as adults, but because babies are growing exponentially throughout their first really 2 years of life. Sleep is a primary function for us to be able, for the babies to be able to grow during that time, to be able to absorb everything they're learning as they're growing developmentally and cognitively exponentially during that time frame.
Thank you so much for that excellent answer, and I couldn't agree more as well too. Our major other question that a lot of our families have is regarding sleep training. It's an ambitious task, so it's daunting for many of our families. And so, can we ask a few questions about sleep training and what is exactly sleep training?
Yes, I love that question too. When we think about sleep training, like you said, it could be literally, it could feel like you are climbing like Mount Everest. To fix sleep seems like such a daunting task. And when we really get to the crux of what sleep training is, it is teaching your child those healthy sleep habits, healthy hygiene in a way that is conducive to their development. So, for example, when we talk about sleep training for a newborn, sleep training is not like a fixed methodology for newborns because they are wired and they grow and develop and they thrive off of proximity to their parents. So when we talk about those methods, it is not going to be setting those expectations with newborns that they are going to sleep through the night. Rather, it's the education, teaching those babies those tools and resources to sleep that meets their developmental needs. What I often say is sleep training is not mutually exclusive with using cry it out. It is not mutually exclusive with night weaning either. There are and there are needs to nourish the baby during that first year of life that does involve nursing or bottle feeding at night. But you can still do that and still have an amazing bond with your baby and also get the rest you need. So nothing is an all or nothing approach. It really is the approach that SleepBabe has, the approach that I have, and I'm so proud of that works with my clients is really a customized plan that is aligning what your baby needs and what you need as a parent too, and making sure that you are getting the rest you need and deserve to be your full self. So sleep training is very misunderstood, and there are a lot of misconceptions of what sleep training means. And one of the things I'm so passionate about is clarifying what those preconceived notions are, knowing that you do not have to separate from your baby to sleep train, and you can have your baby safely in that bassinet or that crib right next to you and still sleep through the night. So it's not mutually exclusive with separation as well.
Thank you so much for that wonderful answer as well, too. Um, Another question that we have on sleep training particularly is there a specific age range that we work with? Is it too late to sleep train my child, or is it too early to sleep train my child? Those are some questions that our parents always have.
Yes, absolutely. So when we think about what an ideal age to sleep train, first of all, it's never too late. We are learning skills all the time, and even some adults are not great skill, like they don't have those skills to sleep great either. So it is absolutely never too late. The ages I focus on are 0 to 8 years old. That being said, when we talk about when to sleep train a baby, what we're looking for is for that day and nighttime confusion to be cleared out. So that's that cortisol and melatonin released, for that cycling to even out. And we're looking for their sleep cycles to be more mature. Babies are born with a very immature sleep cycle. It makes sense. They were in that dark womb that whole time. So when we think about what those sleep cycles look like, it does look like it is influenced by the temperature, the environment. So when it is dark out, that's when melatonin is released. That's when cortisol levels are suppressed. And same thing during daylight, that's when cortisol levels are released and melatonin is suppressed. So we're waiting for that cycle to mature. And also for their sleep cycles, that REM and non-REM cycle to mature as well. This usually does take until that anywhere between that 14 to 16-week time frame at that age, when that sleep cycles, their melatonin and cortisol levels are established. So really starting around 4 months is when you can have those methodologies in place to provide your baby those skills to have greater stretches of sleep. And also, like I wanted to mention, never too late. I work with toddlers at 3 years old. I work with 8-year-olds. So never too late to be able to give your baby those skills and those tools and resources.
Thank you so much for letting us know about the age range and giving us some expectations there as well too. And you did mention some methodology. So a lot of our families want to know what methods are used in sleep training. What are the most common methods that are out there?
Yep, absolutely. So with like the cry it out is one method. That's literally extinction, where you just leave your baby in their room to fall asleep out of mere exhaustion from crying. At SleepBabe, in full transparency, we don't use cry it out. That's not what aligns with what my values are as parents. So there are other methods that we do use. One is the Ferber method, which is very much timed extinction. That is when you basically have, you've made sure all your baby's needs are met, their diapers changed, they're fully fed, and you are letting your baby, giving them that space in a timed, very methodical interval approach, giving your baby that time and the space to learn how to self-soothe. And if they're not self-soothing in that specific interval, you're checking back in and making sure everything is okay. That key to any methodology that you use is the consistency in which you do so. So Ferber is one that's a very methodical, very much aligned with, okay, 5 minutes, 8 minutes, and it's a progressive increase in time of allowing your baby to self-soothe. There are other approaches which actually don't even involve you leaving the room. It's a very gradual approach. That's the chair method, which you are basically, you start your chair really close to your baby's crib or their bed. And even, if a toddler or an older child is used to you being right next to them in that bed for them to go to sleep, it's a gradual approach where each night you slowly go a little further away, whether that's through a chair, your physical body, and then eventually night after night, extremely gradual approach, you're able to leave the room to allow them to learn those independent sleep skills. There are other really popular approaches. One that I absolutely love is a verbal reassurance approach, especially for those kids and those toddlers that get really stimulated by the parents' like physical touch. One that I love is a very simple reassurance statement, which includes a fact, an assurance, and an action in the calmest, zenest voice. And it eliminates that physical touch, but it is that verbal reassurance. So an example of that three-pronged statement would be, it is time to go to bed. You are safe. Put your head down on the bed. So it's a very much, and it's a repetitive, your calmest, zenest voice, reassuring them that they are safe and they are okay. And there are a lot more approaches. I think I named 4, but there were so many others that I really customized to be able to align the parents' approach to crying and also the baby's temperament and the child's temperament, because we know babies are not robots, children are not robots, and neither are parents. So a lot of the work I do and what's really meaningful to the families I work with is really customizing and not having a cookie cutter approach to every family that I work with. One other aspect I did want to talk about is when we do talk about crying in sleep training, it is understandable that your baby, especially at the baby age, that is going to be crying. And it's really hard as parents to see your baby so unhappy. So before even that phase, I often prepare parents telling them that if you have met all your baby's needs, if their diapers changed and you have fed them and you know they are not in any pain, they are literally crying out of protest for learning a new skill. So when you have that in the back of your mind saying, hey, I get frustrated when I'm learning something too, then it makes it a bit more digestible. So it's knowing that you have served all your baby's needs. They're not in pain, not in discomfort. They're literally just protesting the learning of a new skill. Then you could come to sleep training with a more holistic and just you yourself, the parents themselves being in a better state of mind. And it is really up to the parents on how much they can tolerate them being their baby, them giving their baby that time to learn that new skill and that protesting. So I work a lot on that as well, coaching the parents.
Sounds good. Thank you so much. One other thing, Colette, unfortunately, what we wanted to do as well, I think we're going to do like segues too. One thing that we're going to probably do for the questions afterwards, these are kind of like interrupted questions. So, meaning like we're going to do like distinct question and answer sessions. So, at the end of each question and answer, we're just going to reintroduce ourselves. So, it's like kind of like, oh, this is Dr. Noor from Progressive Pediatrics. This is Colette from, a sleep coach from your center there. So
Yeah.
we'll just end off each question and answer with that, and then we go to the next question. Is that okay?
Perfect. Yep,
All
absolutely. So
right.
at the end, after I'm done answering, and I'll just say, and this is Colette from Certified Pediatric Sleep
Perfect.
Coach. Okay, perfect.
Perfect. Yeah.
Yeah,
And then I'll just say this is Dr. Noor from Progressive Pediatrics, and then we'll go to the next question.
perfect.
All right. So the next question, oh, my phone just shut off on me. I apologize. Let me open here. Okay. Um, So, a lot of our questions come from families that are concerned about wake windows. And what are these wake windows? Should I be worried that my child does not observe the wake windows per their age limits? When should I be concerned? And is there any advice that you can give on this?
Yep, awesome. So when we talk about windows, what we were talking about is very loose guidelines of how long age appropriately your baby's sleep awake capacity is. So what happens is as the babies grow, their sleep needs change, and that sleep pressure, their urge to fall asleep does increase a bit later. So the urge to sleep, think of that as like their gas tank. So filling up that gas tank to a point when they are ready to sleep increases, that time increases. So when we talk about wake windows, they are extremely loose. How I think about wake windows is it's a tool in the toolbox for you to be able to understand what your baby's sleep needs are, because each baby is so incredibly different. I tell my parents add 30 plus, 30 minus minutes, just based on what your baby's sleep needs are. Some babies have very high sleep needs, others have very low sleep needs, and that is perfectly fine as long as they're happy and they're getting the sleep they need in totality between their daytime and nighttime sleep. So when we're talking about newborns, they sleep a whole lot. That is their job, to restore, grow, develop. So that newborn, they could be sleeping anywhere like in that 24-hour period between 14 and 20 hours. That range is long. It's a wide range of sleeping throughout the day. So their wake windows, not even worth recording, because they are nursing to sleep. They are feeding to sleep. They are taking those contact naps. They're doing everything, and the parents are giving them everything developmentally that they need to grow and develop. So newborn phase, not even worth looking at those wake windows. When it is valuable is at that 4-month, around that 3 to 4 month time frame, when their sleep is a bit more consolidated, because their sleep anatomy has developed a bit more. So that's when it is really helpful as a tool in the toolbox. I often say, when you are going by a wake window schedule and that is your only reference, you could be missing an opportunity to really get to know your baby so well. So I love the combination of wake windows and understanding your baby's sleepy cues so well. So that sleepy cues, think of that as your baby's physical signals that they're tired. So very common are, rubbing their eyes, pulling their ears, those big yawns. And you want to really understand what your baby's sleep cues are to catch your baby at the right time to go to sleep, whether that's nap time or bedtime. And what I do also tell parents is that combination is a beautiful recipe for being able to teach your baby those sleep skills, have smoother bedtimes and nap times as well. And this is Colette from YourSleepBabe, certified pediatric sleep coach.
And this is Dr. Hadija Noor from Progressive Pediatrics. So let me pull up the other questions. They're going to probably like split this up into little ones.
Yeah,
All
that's
right.
great.
Okay. Some of our parents are very worried that their child does not sleep at certain times. I have some families that put their baby to sleep at 8 p.m. Some babies, they sleep at 10 p.m. Should I be worried that my baby does not sleep at a certain time? Is there any circadian rhythm implications to this, where my baby needs to have good enough sleep if I put them to sleep at a certain time? And when should I expect my babies to sleep in the beginning of the night?
Great question. So when we talk about bedtime, one thing to make sure and to settle those expectations, newborns, like the infant below really 3 months, their bedtime is very late. So you could expect you putting your newborn, your 3-month-old, anywhere really up to like 9 p.m., 10 p.m. Their sleep is extremely erratic. It is not mature. So their daytime and nighttime confusion is still there. So starting their bedtime routine is a good exercise in creating that anticipatory approach, which I love. So you can start that routine day one and just level set those expectations. It's going to be a later time for those newborns. When we get to that anywhere between 3 and 4 month age group, that is when their wake windows, that you could start to follow those wake windows, and you'll see that their tolerance is going to be a lot earlier. So they're going to have, you're going to see maybe a more consistent routine during the day. And that consistent routine during that day, especially at that 4 month time frame, they'll likely be on 4 naps. Their wake windows are going to be about, an hour and a half or so. You're going to see that that time frame is going to be dependent upon what works for your baby, what works for you. It's not, I am not one to say it's 8 o'clock on the dot. What I tell my family is obviously look at wake windows, look at the sleepy cues, but also when you are deciding upon a bedtime, you'll want to create a really consistent bedtime routine to build that anticipatory approach that signals to your baby it's bedtime. It doesn't have to be complicated. It can be very simple. It could be 5 minutes. I say no more than 30 minutes. Just keep it really simple, to the point, what works for you and your family, what gels with you. And when you think about that time per se for bedtime, every day is so different. Your babies nap differently. So you'll want to give yourself plus or minus 30 minutes as well. So say if you and your family, an ideal bedtime is 8 p.m., you'll want to give yourself that buffer of 7:30 to 8:30 of that hour being your bedtime. So any time frame within that would be perfect. The other thing I did want to mention is that we'll take this part out.
Yeah, no worries.
And my name is Colette, and I'm a certified pediatric sleep coach at SleepBabe.
Thank you, Colette. My name is Dr. Noor. I'm calling from Progressive Pediatrics at Bayonne and Union City locations. All right.
Thank you for that.
That's
And
okay. We can
I'm
kind
sure
of
they're
like
going to run through
we
the whole
can
thing.
literally that's the beauty of this. So it's not like a live event, when you lose
Yes.
that train of thought. I completely understand. A lot of this is going to be edited, and they're probably going to edit it in like, where it's naturally segueing. So it's okay. We're gonna do like little blips. It's gonna be like 5 minute, 4 minute videos.
I love it.
So I'm glad
And I
that we
didn't
have
have,
this.
like, now that I'm
Yeah.
thinking about it, it's not that I had anything else in my head. So I was just like
Yeah.
going
Yeah.
on a
And
roll.
sometimes it happens with these videos, you kind of like go on and you're like, okay, I think I'm done, but I don't know why I just started that sentence.
Exactly.
And I've
Thank you,
had that
Dr.
before
Noor.
too. And it was like very intimidating when it happened to me midstream when I was doing like an asthma talk with live.
Oh,
So it was like,
yes.
oh no. And then
Yeah,
I
like, how do
kind
I
of quickly
pivot?
like went into another segment and I was like, okay. I always
Yeah.
have my like phone out or something for like notes though, but yeah.
Yes, you're so good. You're doing so good. Oh my gosh, this is
You're
fun.
doing excellent. Thank you
Oh,
so much for all of these. And I'm learning too, because a lot of these questions also stem from us providers too. So that last question was another provider of ours had that question. Like,
oh,
should
nice.
like a lot of families ask me about this, like, should I give them as advice too?
Yes.
So
Oh,
like,
that's awesome.
so it's great. Like I was just asking other providers in the practice about this too. And I know time is running a little short. Can we do one more
Yes,
question?
of course.
And
Yes.
depending on how we do, and if like, like our patients like this and your practice likes this, like collaboration, maybe we can do like a part two if you're up for it
Oh
too.
my, would love, would love, would love. This is fun. This
Sounds
is like
great. And it's like,
favorite
it's
part of my
great that,
day.
we'll both, our patient population definitely will benefit from these videos
Yeah.
because
Oh,
they
I'm
always
so
have
happy
these
to hear that.
questions.
I'm so happy
All
to hear
right.
that.
And so like we just have like one other question. I mean, I had like more, but I think we'll like maybe do like one other question and we'll end off
Yeah,
there. I know I want to respect your time too.
of course.
All right. So in terms of sleep training, many of our families have questions about how to feed their baby before bedtime and when should they aim to feed their baby before putting them down for their bedtime routine or starting their bedtime routine.
Yeah. So I am a huge fan of this. Me, myself, I had struggles breastfeeding. So when my daughter and I had a successful breastfeeding journey, that was not something I wanted to eliminate when I wanted the sleep I needed. I just needed more intentional space to get the rest I needed. So one of the methods that I did use, which I love sharing with my family, to break that feed to sleep association. It is not eliminating the feed. It's not all or nothing. What I love to tell my families to do is move the feed earlier on in the bedtime routine. This is a very simple act to do. It's giving your baby the soothing that they need and the comfort and the full feeding, while breaking that association between sleep and feeding and creating that approach and that mentality that feeding is a whole separate, needed, lovely activity that is distinguished from sleep. So what I love to tell my parents is in a typical, very typical routine, especially for newborns, and even you see it with babies older, is, diaper change, PJs, lullaby, book, and then nurse to sleep. So a very easy thing to do is move that feeding earlier in the routine. So an example of that would be change their diaper, nurse them while they're only in their diaper. The lights are on, there's activity, it's engaging. I literally, with my third one, I was nursing at that bedtime routine while my two other girls were like running laps around us. So it was very engaging. But I made sure that my baby was having her full feed, whether that's bottle feeding or nursing. And then you go to put them in PJs, lullaby, book. And then the key to putting your baby down when they're so used to that feed to sleep association is putting your baby down calm, ready for bed, and awake. So oftentimes there's that phrase, put your baby down drowsy but awake. I'm going to poo-poo that because drowsy is a super subjective term that could mean that your baby is already in their first sleep cycle. So I like the idea of putting your baby calm, ready for bed, and awake. And the key to the calm is understanding your baby's sleep cues, understanding their physical signals that they're sending you, telling you that they are tired, and catching them at those sleep cues to put them down. So it's soothing them, it's comforting them until they are calm, whether they like to be rocked, they like to be patted, whatever is their jam in comforting them and soothing them. It's giving them that, their cuddles, whatever that may be, until they are calm, they're wide awake. You're going to see they're wide awake, and you're going to put them down while they are awake. My name is Colette, a certified pediatric sleep coach from SleepBabe.
And thank you so much. And this is Dr. Noor from Progressive Pediatrics at both Bayonne and Union City locations. Thank you so much. This was so great. I'm so happy that, definitely our patients are definitely going to like this because there's a lot of questions on sleep.
Yes.
And a lot of it is like, there is that intuitive nature to it, but, they just need that reassurance. And I
Yes.
think these videos will definitely give that reassurance to the families. And I liked how you brought in, like, it's emotionally toiling to do sleep training. And so like the cry it out method is definitely something that, our older providers definitely recommend. But, that said, the Ferber method is something that most of our providers definitely recommend. And I like that you touched upon that for our families too. So I'm glad that, we're doing this with the over
Yes.
video too. Cause like every time, like, families, they're like, oh, what did the doctor say? Let me pull up the video on this.
Yeah.
And this is going to be a nice resource for them.
I hope so. This is amazing. The other thing I will say is that
Yeah.
sometimes I think I mentioned it as well. Sometimes Ferber does not resonate with people. Like
Yeah,
they don't like
yeah.
the
And you
rigid.
mentioned that too. You
Yeah,
mentioned
good.
that too.
I'm glad I
And you
did.
mentioned a couple other methods as well too. And that's one
Yes,
thing. It's more like touching on it. And if they
yes.
have more questions, they can always reach out to us.
Oh, one question. Could you ask how they could reach out to me and how they could work with me?
Okay, sure.
Do we have
Sounds
time
good.
for that?
I think we have like a minute, so let's do this.
Okay,
All
perfect.
right.
Yes.
This is Dr. Noor from Progressive Pediatrics, and we have our sleep coach on with us. how can we reach you, Miss Colette, and ask for your guidance?
Absolutely. So you can reach me on Instagram at YourSleepBabe. I have a website, www.yoursleepbabe.com. And feel free to DM me, email me at Colette at yoursleepbabe.com. And also, I have methods to work with me, whether that is workshops locally. I'm hosting Eat, Play, Sleep in Jersey City, October 4th, which is a great event for parents with babies 3 to 12 months. And I also have one-on-one coaching opportunities as well.
Thank you so much, Colette. And this is Dr. Noor again, coming from Progressive Pediatrics at Bayonne and Union City locations. And we look forward to seeing you at your next well visit and sick visits, and we can talk about sleep as well.
Awesome. Thank
So
you.
that's great.
You are so good. Thank you.
Thank you
Um,
so much again. And we'll see, like, hopefully we'll do a part two. I have like another six other questions. So, like, if we can do like something like this again, that would be nice. We'll see how, like, our patients like it both. And if you're up
yes.
for it, we can even schedule
Oh, no.
another one of these
I would
half an hour
absolutely love
sessions.
it.
Yeah.
Let me, who's on your media team that I could reach out to just to make sure they
So
link everything and they have my resources too?
sure. So it would be Miss Angie Torres and Miss Ashley Pazmino who will be likely contacting you if you need like this video sent over to you as well
Perfect.
too, because I know you wanted to also put it up on your social media page as well too. So
Yes.
we would love to have that. That
Awesome.
said, I think this was very productive. Like, I
Yes.
really enjoyed it.
Oh,
So
good.
I'm
Yeah.
glad I got to meet you over the video and hopefully in person one day too.
I hope so. So for the
Yeah,
event Eat, Play, Sleep, you have
yeah,
Progressive is sponsoring it, so we have tickets. So would love for you to come.
yeah, sounds great. So hopefully we'll meet then.
Yes, I hope so. Thank you so much, Dr. Noor.
Of
It's a pleasure. I
course.
had a blast.
Thank you again. I had a blast too. Thank you.
Thank you.
Take
Have
care
such a
then.
beautiful day. Appreciate
You
you.
too. Have a great afternoon. Bye-bye
Bye.
now.